Please note, this episode includes descriptions of traumatic childbirth and medical procedures, including needles.
No, I'm not okay. And this is not okay. I know it's going to be okay eventually, but we're not there yet. So I could definitely see if I didn't have anybody, I'm not sure if I could have processed the whole thing the way I did.
I'm not normally an anxious person when it comes to big crowds or anything like that, but this pandemic opened up a whole new aspect of having anxiety. It was a lot.
Can you say, "This is Dr. Amanda Zalahusky"?
Why do we have to?
Just try it.
Oh, I can't.
Deep breath. Okay.
This is Dr. Amanda Zalahusky. Lindsay Malloy. Ah!
Now, wait, say Dr. Lindsay Malloy.
Dr. Lindsay Malloy.
No, come back.
This is Dr. Lindsay Malloy. Welcome to the Paternal Parenting Podcast.
One more time.
And then after that, can we have a candy flip?
No.
Please, Mommy.
Okay, ready?
Pandemic Parenting Podcast.
Excellent.
Welcome to Season 2 of the Pandemic Parenting Podcast. I'm Dr. Amanda Zalahusky. My co-host, Dr. Lindsay Malloy, is away on a much-deserved research sabbatical, so I'm going to do my best to hold things down for the both of us on this season of the podcast. Back in 2020, Lindsay and I founded Pandemic Parenting in order to share science-based research and to help all who care for kids navigate this challenging time together. Researchers around the world, including Lindsay and myself, have been hard at work researching the impact of COVID-19 on children and families. We've tracked more than 200 of these studies being published, and this season, we're going to discuss many of the direct implications for us parents. So let's dive in. Please note that the information contained in this podcast and on the Pandemic Parenting website are intended for educational purposes only. Nothing discussed in this podcast or provided on the website are intended to be a substitute for professional psychological advice, diagnosis, or treatment. No doctor-patient relationship is formed between the hosts or guests of this podcast and listeners. If you need the qualified advice of a mental health or medical provider, we encourage you to seek one in your area. Welcome back to part 2 of our Generation COVID series, where we're exploring the impact of the pandemic on pregnant and postpartum parents. In our previous episode, we talked about parents' experiences specifically around fertility treatments and pregnancy, and what recent research tells us about infant development in the first 18 months after a COVID-era birth. In this episode, we're focusing on childbirth and parent mental health. We'll discuss the pandemic impact on childbirthing experiences, the increase in traumatic childbirths, and the overall mental health challenges new parents have faced in these uncertain times. I had the opportunity to sit down and talk with Dr. Sharon Dekel to discuss her latest research on pandemic childbirth experiences. Dr. Dekel is Assistant Professor of Psychology in the Psychiatry Department at Harvard Medical School and Director of the Postpartum Traumatic Stress Laboratory at Massachusetts General Hospital. She is known internationally for her research on childbirth-related post-traumatic stress.
My research focuses on what it means to have mental illness during pregnancy and the postpartum, focusing especially on what it means to actually have a psychologically traumatic birth experience and how this might eventually influence how you are coping during the first year of the postpartum and the first year of your child's life, and the implications on mother's health as well as the infant development. Our lab, as many other labs, is really out there in order to kind of make research on parenting and maternal mental health more profound, especially in this era when a lot of parents possibly are struggling with different mental health conditions at different levels that might impact their infant in the context of the pandemic.
Yeah. So you took some pivots, if you will, or shifts, right, with your research as the pandemic began. Talk a little bit about how, you were studying many of these concepts already, but then you adapted it in our current context.
That's a great question, Amanda. The pandemic hit science in a very harsh way, and most of our research is done kind of in the hospital. We have women who recently gave birth, and they participate in studies in our laboratory at Mass General. During the pandemic, these research activities have been paused, especially at the peak of the pandemic. Eventually, everything recovered. That's I'm happy. So we felt like, oh my God, we're not really doing anything to ideally document the toll of the pandemic on mental health. And I say maternal mental health, but clearly maternal mental health is not only women, could be also their partners. So we felt actually in many ways very kind of tied to these COVID restrictions of not really bringing participants to our laboratory. But nevertheless, we had this very urge coming from more kind of anecdotal cases, knowing that possibly there is a lot of adversity in terms of mental health when it comes to new parents. So our study launched again in April 2nd, 2020. Eventually, we were able to recruit more than 3,200 women. So it's a relatively large data set, includes questionnaires as well as relatively in-depth narratives of the childbirth experience. And this is all actually resonates with my studies before the pandemic, that I'm always so grateful for the parents, in this case, again, the mothers, who are willing to share their stories.
Hi, this is Victoria Burek. I'm one of the producers of the Pandemic Parenting Podcast.
Typically behind the scenes, our producer Victoria got in front of the mic this episode. She interviewed her friend Jillian, who gave birth to baby Colin prematurely in October 2020.
I'm a mother of 3, one being my biological son. I have 2 stepchildren. And we got pregnant during the pandemic, like right after it started. It was a surprise. I actually thought I had the stomach flu.
Oh no.
And I went to Target and bought like Pepto and saltines. And as a joke, like whenever I have a stomach bug, I always pick up a pregnancy test. And at that time it was positive. It wasn't a joke. It was like 3 days before Robert's like 30th birthday. So it was my present to him, I guess.
Yeah. What was that initial feeling, realizing you were pregnant when maybe you weren't expecting to be, and right after the pandemic lockdown started and stuff like that?
It was definitely a surprise. There's a lot of shock. For like 3 or 4 days, we were in shock because I was always told like I couldn't have kids. So yeah, definitely a surprise. And then at that initial point was like April. So we were like, oh, it's going to be over soon. Right. Like that was the mindset. Like at work, we were talking about like, oh, we're going to go back to the office soon. So definitely in the beginning, I was like, it's going to be over soon. And now halfway through, I was like, this is never going to be over. Yeah. I basically only left my house to go to the doctor. I didn't have to go to the office because I was pregnant. My boss was like, oh no, don't, and for anything that they call us in for, like, you can't come. She was really worried that like something bad was going to happen. You know, we didn't really see our family too much. My mom lives in a different state. And then Robert's parents, actually, they were like frontline workers. They were, you know, out. So they were always coming in contact with COVID. So they didn't see us that much either. So it's just me and Robert, my little bubble. We didn't really have my bonus children either because we were afraid they were going to get sick, or who were they around? Because their mom is also a frontline worker. It's just very much us in our little house. But Robert and I, we did pretty good as far as a couple. He was really supportive during everything. I mean, he couldn't come to any appointments. So like his only time to feel connected to our son was like when I was home, trying to like see if he'd kick or move or something. He didn't do a whole lot of that, but he tried to. And that was like a good time for him to connect to the baby because he didn't get to hear the heartbeat or see the first ultrasound, anything like that.
And was that because of pandemic restrictions or work schedule complex? Yeah.
No, pandemic. Yeah. The doctor, she only let the patient in.
So my name's Dan Smiley.
And I'm Stacy Smiley.
We've been married for 7.5 years.
In part 1 of our Generation COVID series, we heard Dan and Stacy share parts of their journey to parenthood during the pandemic. In spring 2022, their beautiful daughter was born. In this episode, you'll hear Dan and Stacy talk about how the pressures and anxieties of the pandemic, on top of fertility treatments, pregnancy, and becoming a new parent, impacted their mental health. You both talked about like wanting kids for so long and then recognizing, all right, this isn't as easy as we thought it was going to be. We're clearly going to need to go the route of, you know, assistive technology or fertility treatments before the pandemic. So like when you just sort of think about, okay, and then, wow, we were right in the middle of a pandemic for this, like what else was different about it? Do you think, having been on this journey in the midst of a pandemic versus not? Like what other delays did you feel, or maybe fears you had, or just things that weren't accessible, or just what else felt different about it than what you imagined?
Fears for me was getting sick.
even though I was vaccinated, was just getting sick while pregnant. Being newly pregnant or getting pregnant, I didn't know how I would have bad morning sickness or anything like that. I also didn't want to get sick. You just have that fear in the back of your head, halfway during a pandemic that's still going on, whether it's, the summertime or not, numbers were still what they were. So that was a fear for me. And with the pandemic, obviously, we spoke on our delays prior to, but once we were able to finally do it, obviously another fear was like, I hope I can carry this pregnancy because I don't want to do this again. Or if I have to do it again, it's just going to be another, setback physically and emotionally. So like any female, that's what you think about. I was obviously lucky enough that, she was healthy and I carried to term. So that was a fear that I had during the whole pandemic, was that. And then just with everything that was protocols at the hospitals and clinics, there were more heavy protocols a year ago. So, I was just always worried, am I going to be doing a lot of this alone? Am I going to be going to a lot of these appointments alone? Which I did every 4-week appointments or every couple of month appointments in the beginning of the pregnancy. I had to do a lot of those alone, which was okay. I mean, I wasn't too heartbroken about it, but once we got to the appointments with the ultrasound, I was worried he wouldn't be there. And so we were lucky enough with our office that they were more flexible with allowing spouses coming to those types of appointments.
Yeah, the OB was great with that. Like they were, yes, please come see your child kicking and moving and hearing everything. And I can't not say I didn't cry almost every time that happened. It's it's a real thing. But I was with her. When we locked down, and by we locked down, I mean even Stacy and I locked down. Like we didn't go anywhere. We chose to have everything delivered to the house for, I would say, more than just the first 3 months.
Yeah.
And then my office was the first to open up between the two of us. And that's where I started being like very skittish about everything. I like being around people. I'm not normally an anxious person when it comes to big crowds or anything like that, but like this pandemic opened up a whole new aspect of having anxiety. It was a lot.
Yeah, like trying to control so much of the uncontrollable, right? Is just this sort of recipe for anxiety in a lot of ways. And I think some of the fears you both talked about, they're so real, and it's really hard for people to understand when they're not in that situation, like what that fear looks like. That what if I'm alone when I have to deliver this baby? Like that's a very real possibility. And that's terrifying, especially the first time you're going through it. There's so many unknowns as it is. And then there's all these extra unknowns because of the context you're in.
To your point, like being first-time parents, I've always dreamed about being there when my child is born. Like it's never been a second guess. And knowing that some parents, especially in the beginning of the pandemic, dads weren't allowed to be there. And it's the most heartbreaking thing to hear that.
Yeah, we had a friend she had her baby in April of 2020. And just hearing that her husband wasn't able to be in the delivery room when their baby was born was just, it was gut-wrenching. And just hearing that when, obviously things were put on a little halt for us that year, trying to get pregnant, I just thought like, oh my gosh, I couldn't imagine. And I hope that, that's not us, fast forward a year later. And we still had that worry. I mean, with the numbers were rising in the fall and the winter, and I obviously was doing the spring with her, it just kept, I think it was January of this year that the numbers went up again. And my fear was the hospital's going to limit who I can bring. And I really was so worried that he wasn't going to be able to be there.
Well, and obviously let's fast forward to like her being born, seeing what Stacy went through with the birth itself. There's no way I'd fight people to go to make sure I was in there. Like it was just the labor itself was, I couldn't imagine her not having me by her side for that time, let alone, when she was born, and just, she couldn't even really take care of her for the first 2 days in and of itself.
It's truly the most vulnerable. Yeah, it's the most vulnerable moments I remember in my life. I can ever imagine for a birthing parent, like it's just, you're completely at the mercy of this process.
Well, in the hospital too, initially was like, they were pretty strict back in January about like, if she tested positive for COVID, I couldn't be there. Later, we found out if she tested positive, I still could have been there, but I couldn't have left the hospital at all. I just had to be there. And the fact that we were there for 6, almost 7 days, that would have been awful. Just in the aspect of needing a shower and getting real food. But
well, just those mental gymnastics you put yourselves through, right? For the months leading up to it. Okay, if this, then this, and what if this, then that? That's exhausting in itself when it's already an unpredictable situation. I'm also just thinking about the way you talked about anxiety, Dan, that like thought you were anxious before, and then you brought this little human into the world and welcome to parenting. We're anxious about everything now. If you weren't before.
Yeah. And we still are. I mean, we only just had her, and it's like this pandemic is still here. Are people mentally a little bit more at ease with, just everything being out socially? Yes. Are we in a better place than we were 2 years ago? Absolutely. But this is not over. It hasn't ended. And, we still hear things. Oh, we heard numbers rising again. I'm like, oh, geez. I'm like, and it just makes me think of like her future in the next year. Like, what does that mean for her and us?
In Dr. Dekel's research, the women surveyed completed a more formal questionnaire and were also asked to share the story of their childbirth experience in a narrative form. This gave Dr. Dekel's team insight into more specific details of each woman's story.
We noticed that many women, I would say roughly a third of women in these who reported these childbirth narratives, talk about the adverse, significantly negative impact of the pandemic on the childbirth experience. Women kind of contrasting this expectations of, especially first-time mothers, what it means to actually give birth and, all their birth plan and coming to the hospital with their support person and how they want to show their newborn to their family and to their mother and how would they want their parents to visit them after, and all this was kind of abruptly, in many ways, denied from them for possibly, most likely good reasons. But nevertheless, the kind of the discrepancy between the expectations and the reality for many women seemed like it became really traumatic. And when I say seemed like it became really traumatic, I actually would say it did become really traumatic. So what we did in our research, again, our lab is focused specifically pre-pandemic on understanding kind of to what extent childbirth could become traumatic and how this traumatic experience could result in maternal PTSD, post-traumatic stress disorder. During the pandemic, we basically use the same questionnaire that we use in our research pre-pandemic, and these questionnaires are adopted from research on what I would call traditional trauma. For example, individuals who are exposed to automobile accidents, sexual assault, as well as war and combat. And we asked women who recently gave birth, especially those who gave birth during the pandemic, to complete these, let's say, combat-related questionnaires adopted for the childbirth experience. And luckily enough, in our sample, we had women who gave birth during the pandemic, as well as those who were postpartum during the pandemic, but actually gave birth before the pandemic. So we compare these two groups on this questionnaire, which is kind of to assess the traumatic stress during the pandemic. And we found that women who gave birth during the pandemic were 40 times more likely to have an acute response to childbirth. And based on our data, roughly 1 out of 4 at least reported a traumatic response to their childbirth. In this sample, we excluded women who were positive for the pandemic. So we only studied women who were presumably healthy.
Sure.
And therefore, the traumatic response that has been increased possibly not relates to the fact that they had the virus, because they didn't, but it might relate to these added, what I would call kind of contextual stressors of giving birth during the pandemic, such as giving birth in the hospital that is basically transformed to address COVID-19 patients, a hospital that is operating under new COVID-19 regulations. And for a significant group of women in our sample, I think it was roughly 25%, women who actually were not allowed to have a support person, either labor, delivery, or during a maternity hospitalization stay. And possibly these factors of not having a support person to some extent might have contributed to the traumatic experience of childbirth.
Yeah, both the combination of all these changes and protocols, but also the expectations you talked about in the beginning. Like, here's how especially new parents imagine this whole process is going to go. They've been dreaming about that, maybe for a really long time. And then for it just to not meet those expectations or have so much sort of loss in the ways they expected to be supported throughout this whole process.
Moving forward a little bit, Colin is doing well now, but his first several weeks were really difficult. And so as much as you're comfortable sharing, can you walk us through what your premature childbirth experience was like?
Sure. I went in for a routine visit at 31 weeks and they're like, oh, your blood pressure's a little high. And I was like, okay, that's not uncommon. I just came from a work meeting and I'm a little frustrated. So they had me sit and then they took it again and it was a little bit higher. And then they took it again and it was a little bit higher. And they're like, okay, you're gonna have to go to the hospital. Because I was already a high risk pregnancy. I have a clotting disorder. I was on blood thinners through my whole pregnancy. So the only hospital that had a NICU that could take my baby, because under 33 weeks, I had to go to like a level 1 trauma hospital, was about 45 minutes away. So I went home. I packed some things because I wasn't ready yet.
Yeah.
I'm a procrastinator to the fault. I didn't have a bag or anything. Robert was sleeping because he's working night shift. So I woke him up. I told him and he was freaking out. And I was like, no, it's fine. Like, they told me to come in and they'll get my blood pressure down and I'll come home. Like, no. And if anything, it'll be like bed rest for the next like 9 weeks or 8 weeks, whatever. They decided to take him early. So Robert went to work. I went to the hospital. They admitted me. And over the course of like 12 hours, they decided like I wasn't going to go home. My blood pressure just kept going up and up and up. So they started with steroid shots, which they do to promote quick lung growth in the baby, so they don't have as hard a time breathing when they come out early like that. And then I called Robert, and he was coming back, and he had to go home and pack bags and come. And luckily, his parents lived 15 minutes away from the hospital we were at. So he was able to land there because he couldn't get in that night. The hospital was already like closed to visitors. So yeah, they just monitored me for, I think, felt like 3 days. They ran Pitocin, which basically forces your body to like start contractions and start labor. They ran some kind of other medication to give Colin they called it like a shield around his brain to prevent brain hemorrhaging. So I was doing that. I had epidural. I had a balloon inserted to help force like dilation faster. So after a day of that, I stalled out at 5 centimeters. So they decided to do an emergency C-section.
And at this point, was Robert able to be with you after that first night?
He was. The doctors were really worried that he wasn't going to make it and they were going to have to do an emergency C-section before he got there. But they kept pushing every like 6 hours a medication to reduce my blood pressure. It would work for a little while. But basically right before my C-section, I topped out at 170 over 110. So I had pretty severe preeclampsia. They were really concerned. Usually at that point, you start having seizures and strokes. Luckily, I never had that. I was just there, but I wasn't really there. When I look back on it, it's very like foggy moments. But yeah, he was born. I had an emergency C-section. There was a moment after they got him out that I guess I passed out and everybody stopped for a minute. And like Robert, like tapping my face and being like, listen, Colin's crying, listen to him. It brought me back. But there was a moment like they were worried they're going to have to start like emergency life-saving procedures. But yeah, they got Colin in his little incubator. He weighed 2.5 pounds.
Wow, so little.
15 inches long. Yeah, and that started our lovely long journey in the NICU of 47 days in the NICU.
For those 47 days, Jillian described her experience as an isolated one. She would wake up each day to a set routine of pumping breast milk, driving the 45 minutes to the NICU twice a day, and trying to remember to feed herself and get enough sleep when she could. With Robert's work schedule, he was only able to travel with her to the NICU twice a week, and because of the pandemic restrictions, the NICU was closed to only mom and dad, leaving Jillian and Robert to visit Colin on their own, without the in-person support of their parents, siblings, and other family members.
Looking back, it was definitely pretty traumatic, just from not getting a whole lot of say in what's going to happen.
Mhm.
Emergency C-sections are emergency, but I was hoping to like hang on to like 38, 39 weeks and have a vaginal birth and like be that way. Cause healing either way is really hard. Robert wasn't there. There was nobody, and it's pretty lonely.
Yeah.
And when my mom was actually in town visiting, because we were going to have a baby shower that weekend, and even she couldn't come. So, and like the after effects, they don't know what causes preeclampsia yet. It's still very much a researchable topic, but you can't help but feel guilty about it. And your baby is in the NICU, and there's nothing you can do to help them.
Yeah.
And Robert would always remind me, like, it's not your fault. But it definitely felt like it. Because as a mother, you feel like your one job is to protect your child. And I was just waiting.
Yeah. And you've got all that time to just be by yourself, like you said, because you were, kind of alone in a lot of those NICU experiences, I'm sure.
Yeah.
It's hard to get those thoughts out of your head, even if you know they're not true, or if you've been told they're not true, it's hard to believe it.
Yeah.
In the moment. Yeah.
I'm a very active believer in therapy, and I still, during my pregnancy, after my pregnancy, still now, come to terms with that, because if there was something they could have done, they definitely would have.
Right.
Nobody wants babies in the NICU.
It's really difficult to think about birth possibly as a traumatic event. We think about traumas in the context of war and combat and other horrible world events, for example, the pandemic and being affected by the virus. We don't really think about childbirth in the context of trauma. So clearly trauma doesn't happen for everybody in the context of childbirth. It does happen for a significant group of women, but based on our data, we see that for many women, it's a very stressful experience. And how can we make sure that women are receiving not only the support they need postpartum, but also the support they need when they are in labor and delivery by their family members, and of course, by the treating staff.
Yeah, and like the opportunity to support women in processing those things. In my childbirth experiences, like I just remember feeling, and they weren't traumatic, everything went relatively smoothly, but yet so sort of melancholy. Like this was a really hard thing. Like my body just feels like it was at war for X number of hours each time. It was exhausting. My hormones are all over the place. Like this was really hard. And yet sometimes it felt like the expectation from, whomever, society, family, is like, this is so wonderful and joyful. And it was sort of like, I just need a minute. Like I need to understand and sort of reflect what just happened, especially the first time. And so, and again, that's just in a sort of normal, quote unquote, not traumatic experience, right? So imagine for somebody who just has all of these layers that happen and make this even that much more stressful. I know that there is still often disconnect between, the birthing parent and the non-birthing parent, whether you're in a heterosexual marriage, or not, like just they're different experiences. So I just wondered for you both what that has looked like. Especially I hear this a lot in the fertility journeys, right? That, what that experience looks like maybe for dads versus moms is quite different. So yeah, any thoughts on that?
So I had to give Stacy her shots for 3 months, and I knew she was the strongest person in the world, but when you have to do something where you inflict pain on the person that you love on a daily basis, regardless of how strong that person can handle pain or anything like that, that was the most mentally breaking thing for me for 3 months. And it's still kind of hard to describe to her, let alone anybody else, like my mental journey going through that and how every day was just I dreaded 5 o'clock to give her shots because, I had to do everything in my power to find like the right spot where it wouldn't hurt. Or if she started bruising after certain times, like it was unavoidable. And I have to put the shot in a bruised spot, which obviously can be the most painful thing you can go through. And that it was a long 3-month like mental pretzel I was unfortunately put through on that. And that's not to take away from everything she went through physically for it, and I can't preface enough how I've already known that women are strong, but like to see that like it firsthand is like so eye-opening and awe-inspiring, and just no dude can ever tell you that they can do it. There's not a chance. And if they do, they're lying full-heartedly.
Yeah, for me mentally, it was just the shots that I had to take. And honestly, I mean, as painful as they were, it was just knowing that I was pregnant at that time. It was just a very strong reminder. You got to keep doing this. This is part of, making sure that I have a strong, healthy pregnancy early on up until, I don't have to do it anymore. So mentally for me, it was just making sure that I was in a good headspace. I had to be in the best headspace that I could, because that was going to help me get through the whole pregnancy, whether it was the stress with the pandemic, stress with work, stress with, bringing a child into this world. I mean, just everything at once. I had to put myself in that place to get through it. And for me, it helped. I mean, everyone has, the things that help them get through stuff. And so making sure I was taking care of myself, obviously, number one was how I could do it.
And I think for me, like, I kept that to myself quite a bit throughout at least the first 3 months of it, because it was an unnecessary thing in my eyes that she needed to worry about, and to her point, she needed to be in the best headspace mentally that she could possibly be, so that, everything could go as swimmingly as possible. Communication's always been key. And that's even once Luna was born, I think that was the other thing too, where like postpartum, right? And always to make sure, like, you tell me if you feel something. Like, I'm always going to check on you. If it's annoying, I get it, but like, I'm always going to make sure you're at your best that you need to be at. Yeah. And that's why, like, especially in the beginning of the whole process, it was like, she doesn't need to worry about where I'm at. I can deal with my own thing for the time being, and we'll get there. She just needs to be strong now.
Right. And there are these ways, though, we get so afraid of sort of burdening the other, with our journeys, which is why I think it is so important to talk about, of course, your journey collectively, but individually too.
Yeah, we're still so fresh in, but still, he's been really good about asking me, and not to the point where I'm like annoyed of, okay, good, stop right. Asking me, but he's always doing just like a mental check on me, and seeing when I feel defeated in the day or just emotionally tired, he'll step in. And so, it's been really nice, and I hope it continues.
Yeah.
That's what, what us ladies need to kind of get through, the hump of the first, what do they call it? Is it the fourth trimester?
Right. That's right. Exactly.
Yeah.
That's right.
Well, and I think like what you and I talked about, I want to say last year, is just mental health in itself. I think the pandemic's really opened up a lot of people with the idea of mental health and how important it really is. And, just our struggles, not only, going through this process, but just mental health in itself, period. Whether it was losing our dog or being stopped in not going through IVF, or just being cooped up, every day, it being Groundhog Day, and, maybe the two of us getting sick of each other just because we can't go anywhere.
Right. That's right.
And I think that's why I've always made it, she's always made it a thing to, like, we need to be communicative and check on each other, no matter what.
Yeah. Exactly. Yeah. And someday, as little Luna gets bigger, right? It's amazing modeling for her too. That this is how we put these things out there, how we check in on each other, how we show up for each other, for sure. One of the other things I'm thinking about in your work is a concept that I don't know that a lot of people often are familiar with when you work with trauma, which is the flip side of this in some ways, right? So you mentioned the term resilience and how you looked at resilience, but I'm also, really struck by stories I've heard throughout the last several years about this notion of post-traumatic growth. And so I wondered if you could talk a bit about that concept and, how you might have seen that come into play in your work with some new parents. Are there any benefits maybe to being pregnant or having a baby during the pandemic?
Sure. Especially in the field of psychology and psychiatry, we focus on mental health disorders. So it's all about there are symptoms and how can we kind of minimize or prevent these symptoms. Less so, maybe eventually in one-on-one therapy, focusing on this kind of other side of coping, which would be like post-traumatic growth. And the idea of post-traumatic growth, we're talking at least in a kind of more theoretical level, we're talking about this kind of inner psychological change that the person experiences in the context of undergoing a very stressful event, possibly even traumatic, such as childbirth. And the idea that you feel like there is kind of this psychological transformation. How you are perceiving yourself these days is different from how you perceive yourself, even in this case, before childbirth. So it's kind of not only when we talk about recovery or resilience, we're talking about either people who are not affected by the event, or recovery would be people who actually bounce back to the same psychological levels they were before pregnancy. And this is about growth, meaning that you are enhancing yourself. You're even better psychologically than you were before pregnancy. And what we find about PTG, post-traumatic growth in general, that interesting enough, in many ways, it could coexist with stress. So for example, somebody could say, well, I feel really depressed, but it's important for this person who's feeling postpartum depression to also maybe acknowledge that they are, I just gave birth and actually my birth was really traumatic. And actually I'm like, if I think about it, I was strong to a degree that I actually couldn't even imagine I would be able to encounter such an event, and kind of internalizing that and feeling good about yourself. In our research, we were especially interested in understanding whether women who have traumatic deliveries, are they likely to experience psychological growth? Because we know based on the model is that the stress actually triggers growth. If there is no distress, trauma related, there's usually no growth. And we found that those who report distress and somehow are able to then their distress transform into growth. So for example, again, I had let's say a scenario of the woman who had an unplanned cesarean, and she's like retrospectively reviewing her birth experience and saying, wow, actually I was so strong and I thought I'm not even going to survive. And now I feel I am alive and I'm physically healthy. So things are hard, but I have this other new appreciation to my life and to its meaning. And if I think about how I was maybe supported by my partner, I feel I have this better sense of intimacy. Although again, things are still hard and my birth was not ideal. And how this person can kind of really internalize a sense of psychological growth, which we found is associated with better mother-infant bonding. I think it's important to mention that we still talk about postpartum depression as this kind of one condition. And we know that today, some women could experience more anxiety, not necessarily so much depression. And some women could experience PTSD, and some women could actually experience PTG along with PTSD. And it's important that we kind of consider the wide range of mental health outcomes, opportunities for resilience, and opportunity for growth. Today, there's, the DSM, the Diagnostic Statistical Manual of all the psychiatric disorders. There is only depression with postpartum onset. There is no postpartum anxiety, no postpartum PTSD. I hope that over time, as there will be kind of a formal label for a condition, women will say, well, I actually got this information. I think I actually have PTSD. PTSD could be treatable for some people who reach out to providers, possibly in the early phase following exposure. And I would kind of take care of myself. So this is something I really I'm optimistic that this would be better in the very near future, that there would be more recognition formally of maternal mental health conditions and more funding for research. Recently I gave a talk and I looked at government funding, which we're so appreciative of all the amazing and wonderful support we recently received from NIH. Nevertheless, when you look at, for example, how funding for, let's say, a rare disease such as multiple sclerosis, you see there's much more funding for this condition, which is a rare condition, versus two conditions of maternal mental health. And I really kind of call for more research on maternal mental health to allow for the development of good ways of screening women for conditions. Currently, we have the screening for depression. We're not really screening for other mental health conditions on a more routine basis in hospitals in the US. And treatments are good, but possibly could be improved, especially preventive treatments. And I think, I began my career as a kind of more, what I would say, non-postpartum PTSD research. I studied individuals who were exposed to terrorism and captivity and war. Often, one of the difficulties in treating trauma survivors is that the trauma just happens out of the blue. You don't know when it's going to happen. It's very difficult to then reach survivors. Let's say, think about sexual assault survivors. As we talked about pregnancy, again, not for everybody it's a traumatic event, but it could be stressful. Women, and we possibly have opportunities to make these conversations during pregnancy, after childbirth, approach our providers when we are in the hospital, let's say for those who are in the hospitals for 2 days or 4 days. And there is a lot of, I think, optimism in terms of averting any kind of mental health outcomes, the negative ones, when it comes to postpartum women, because there's kind of very close follow-up in the hospital already that is happening during pregnancy. So we really have a lot of opportunities to make these conversations. I would say at first, actually, something I really want to mention is that an amazing recent outcome in the US is that there is currently a national hotline that has been launched recently that all mothers could, or I think also maybe, I assume also maybe pregnant people, like peripartum individuals, including, I assume partners, could actually call this number. And they'll be able to speak with somebody and possibly be able to reach the treatment they need. So, and I'm so proud to kind of, share this news today. Nevertheless, a lot of people don't seek help, and a lot of people don't have the support they need. And for many people, they might not have the medical insurance they need. So, I hope when we have maybe another podcast in some years from now, there will be a way that, regardless of your income, there will be really as minimal barriers as possible to making sure you are seeking help for your mental health, in this case for pregnant and postpartum mothers.
So to wrap up, I'd love if you have any final thoughts or advice you'd like to share with parents who might have had similar experiences.
My best advice is, if you really think something is wrong, don't let a nurse's line or your doctor's nurse placate you into thinking, oh, it's nothing. You think you're going to be okay. You can't have someone else be your advocate that something's not right and get in front of a doctor. Robert and I truly believe if we had gone into the doctor the week before, they probably could have done something to get my blood pressure lower. But the nurses put us off that, oh, it's fine. It's normal. Like, pain is normal. And that's very common. Like, your whole body aches when you're pregnant. Pain is considered normal, but definitely put yourself in front of a doctor. There's lots of resources out there for things that can happen during pregnancy. So definitely reaching out and just trying to get that support for women who are going through the exact same thing or have been, because it's not a fun place to be once you're in that hospital bed.
I want to just sort of wrap up by asking you, what advice would you have for other parents at all stages of this journey, right? Maybe just beginning it, maybe they had a baby in the midst of the pandemic and felt pretty isolated. Just what have you learned, and what would you like to encourage or remind others?
Encourage is just, despite all the fears of everything going on, do your best to try to find what makes you happy and what keeps, you mentally happy, because the days merge with each other, as we know, and you think more. I feel like I'm thinking more about everything. I mean, when I was pregnant, I would have horrible sleep insomnia, and I would just be thinking of the worst things. Like, why do we think of the worst things? Why can't we think of the best things
at 3 o'clock in the morning?
Yeah.
And I will say it's gotten better just because I'm more distracted with her, but just find the things that make you happy by yourself individually and with your spouse, because that's what's going to help you get through your own, troubles every day.
And I think to continue with find the things that make you happy, there's nothing wrong with finding things to make you happy individually too. Like, obviously, do things with your spouse and things of that nature, but it's not an unhealthy thing to do something by yourself and not be together all the time. I think that helps a marriage and a relationship in itself, because there's got to be individuality to it. I would say something to help new parents or couples going through this is just communication. I've already stressed it, but it's such a big key thing in any relationship. That's the best thing you can do, is to always have the best communication you possibly can have.
This has been an episode of the Pandemic Parenting Podcast. We'd love to connect with you via email or on social media. Follow the links in our show notes or look for our blue and yellow logo when you search Pandemic Parenting on Twitter, Facebook, Instagram, LinkedIn, YouTube, or TikTok. And this podcast isn't all we do. Pandemic Parenting is a 501c3 nonprofit providing free science-based resources for parents and all who care for children while navigating the COVID-19 pandemic. To learn more about our organization and access our extensive library of webinars, videos, blogs, and more, visit www.pandemic-parent.org. This season of the podcast is produced by Victoria Bruick, Carmen Vincent, and myself, Dr. Amanda Zelahusky, with strategic support from Dr. Lindsay Malloy and Pandemic Parenting's Executive Director, Jennifer Valentine. Many thanks to the Pandemic Parenting team for their work in making this show happen, including Miranda Daphne, Lydia Lang, Julianne Matthews, Mark Snow, and Paula Sillers. If you want to support the work of Pandemic Parenting, you can do so in a few ways. You can leave us a 5-star rating and review on Apple or Spotify. You can donate to our nonprofit at www.pandemic-parent.org/support. And lastly, and most importantly, you can share this episode with parents and caregivers in your communities. Until next time, thanks for listening, and please give yourself some grace today.